Today, results from an ACCC survey looking at remote patient monitoring technology. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Remote patient monitoring helps patients communicate with their care teams without going into the clinic. ACCC fielded a study to find out what patients, caregivers, and providers thought about this technology, how it's being used, and its impact on cancer care delivery. Here to share key findings from the survey is Dr. David Penberthy. He's the Medical Director of Radiation Oncology at the Penn State Health Milton S. Hershey Medical Center. He's also the immediate past president of ACCC.
We're all coming through a really challenging point in our history dealing with the recent pandemic, and in some respects, we're still dealing with it. But the pandemic brought to immediate focus some challenges that we've all been experiencing. A couple of things: workforce shortages, how do we stay engaged yet be socially distanced? And we realized that tools and digital tools can really help facilitate continuous engagement. And so we wanted to kind of explore how the cancer community is engaging with digital tools. And so everybody understands, or I should say most people understand, the value of this, but we wanted to formalize this and really study this.
How do digital tools impact the cancer center workforce?
Well, this was really interesting because we asked specifically within the survey, what sort of personnel effort was required and who was actually engaging with the system more, which healthcare team members were. And we found that it was not onerous. And that's a really important concept. And so we have data like, how many hours per week, and it was less than 10, and which personnel were using it most of the time. And it was most of the time an engaged and interested nurse was the one that was really the champion in the cancer center for doing this. Now, through the pandemic, healthcare has been contending with workforce shortages. And so everybody's concerned about how we do more with less. And so using digital tools can actually help facilitate patient engagement with the healthcare team, hopefully keeping people out of the hospital and intervening earlier so we can achieve more of what we're trying to achieve of maintaining health as opposed to just reacting to illness. And so this survey found that the digital tools, there was a little bit of effort required to get it started. And then the ongoing effort was actually quite manageable within the workflow. So that was something that was highlighted and I was pleased to see that once the system got operational, that it was actually fairly straightforward to maintain it with the kind of healthcare team member champion.
Are patients embracing this tool?
We found that there was a pretty uniform enthusiasm for engagement with this. And this is, again, across the age spectrum. We saw, younger people, mid-career people, older adults, everybody was enthusiastic for using this technology. Now, the younger people had less of an effort to get operational. And so the older people that responded to the survey required more hands-on help with setting up the system. And so, but once they were set up with the system, they were using it quite routinely and effectively. And so they were very pleased with the system. And so there was continuous engagement through their healthcare journey through cancer treatment, which is really important for compliance and making sure that people are getting the care they need. We found that engagement was really good with symptom management. It was really good for monitoring vital signs. And those are two little aspects of somebody's healthcare experience that point to when somebody needs a higher level of care. And so if somebody was engaged with the system and their vital signs were at such a level that the healthcare team member was uncomfortable with it, then they would elevate the level of care and do an in-person visit, encourage the patient to come in. But we found that interventions were happening earlier as opposed to later, and that was very gratifying to see. So engagement was high in this. And so I think this is a technology that is coming of age and people are embracing it. And if we can make it so that its cost is not an issue, that the trust factor is high in this, then I can foresee this rolling out into the future more broadly.
Thank you, Dr. Penberthy. You can check out the show notes for a link to the survey results and more information on remote patient monitoring. If you liked this episode, we hope you will take a few seconds to share it with a colleague. Until next time, this is Summer Johnson.
This show is a resource of the Association of Community Cancer Centers.